Welcome to the deep dive.
Great to be here.
So today we're tackling something that probably looks familiar to everyone, that health insurance policy document that lands on the doorstep.
Right, the one that often gets put in a pile for
Exactly. So we're looking specifically at this document, S5328082220.pdf, and the images you sent along with it.
Yeah.
Our mission really is just to pull out the key stuff, what you actually need to know quickly without wading through, all the jargon.
It's about cutting through the noise.
Yeah.
What's covered, what's not, the important conditions.
Think of it as your quick guide to the essentials. Ready to jump in?
Absolutely. These policies can feel, well, pretty dense, but understanding them is so important for that peace of mind, knowing your health finances are protected. We'll flag the big things in this one.
Okay, perfect. Let's start at the top then. Core coverage. What does this thing actually do?
Well, fundamentally, it's there to cover medical expenses. If you have an accident or get sick, pretty standard stuff.
Right. But then point one in that first image immediately brings up pre-existing conditions. And it talks about, 1 year and 3 year waiting periods? Why the difference? Why not just one waiting period?
Yeah, that's interesting.
Yep.
So a pre-existing condition is, any health issue you had before the policy started.
Okay.
The different waiting times, 1 year versus 3 years, well, it often boils down to the insurer's assessment of risk.
Risk, meaning how likely you are to need treatment?
Kind of. Or how expensive that treatment might be. Maybe less complex issues or ones needing less frequent care get the shorter 1 year wait.
And the more serious long-term stuff gets 3 years.
Potentially, yes. Conditions needing more extensive or ongoing treatment might fall into that longer category. It's really about managing the financial risk for the insurance company.
Okay, that makes a certain kind of sense. So it's not an automatic no for coverage, just delayed.
Exactly. And you really need to check your specific policy to see how your conditions, if any, are classified.
Good point. All right, moving to point two. This lists some really significant treatments. Organ transplants, chronic renal failure, cancer care chemo, radiotherapy, even choriocarcinoma.
Yes.
That seems pretty comprehensive for major health scares.
It does. And listing these explicitly, well, it signals the policy's aim to provide a safety net for those really serious and often incredibly costly health events.
Yeah, that kind of coverage provides a significant financial reassurance.
Definitely. It's a big part of the value.
Okay, then point four deals with HIV/AIDS, often a tricky area in insurance.
It can be.
This policy says it covers illnesses resulting from HIV, like opportunistic infections, Kaposi's sarcoma, CNS lymphoma, but then it specifically excludes encephalopathy. Why single that one out for exclusion?
That's a really specific detail, isn't it? While covering HIV-related illnesses is positive, excluding encephalopathy.
Right.
Well, it probably relates to the potential for very high long-term care costs associated with that specific condition in this context.
Another risk management thing.
Likely. Insurers sometimes carve out specific high-cost conditions. If that's a particular concern for you, you'd really want to see if there are other coverage options or riders available.
Okay, good advice. Always check the fine print. And then point five mentions mental health. Good to see that included.
Yes, very much so.
Psychiatric, psychological care, meds, rehab. Seems quite broad.
It's definitely a positive sign. Mental health parity is, thankfully, becoming more common, recognizing that mental well-being is just as vital as physical health.
Absolutely. Access to that kind of care is crucial.
Agreed. Its inclusion makes the policy feel more whole, more comprehensive.
Okay, let's shift focus a bit. Conditions, exclusions. The stuff that limits the coverage. Point 6 in the first image. It says coverage is usually for hospitals or clinics.
Right, in standard places.
But it also covers necessary home care if a doctor recommends it. That feels practical.
It really is. It acknowledges that sometimes the best place for care or recovery isn't a hospital bed. Home care with medical oversight can be better for the patient, more comfortable. That flexibility is a real plus.
Definitely. Now, looking at the second image, point 7, this talks about routine checkups or tests without medical necessity.
Yes, the wellness versus sickness distinction.
It says they're generally not covered unless there's specific preventative things mentioned elsewhere, so it's mostly for when things go wrong.
That's the core idea of most health insurance, yes. It's primarily protection against unexpected costs from illness or injury. Routine checkups are more preventative.
But some prevention is covered.
Often, yes. Many policies do cover specific preventative services,
Huh.
certain screenings, maybe vaccinations. You'd need to find that specific list within the policy documents.
Got it. Okay, point 8, the claims process. Not glamorous, but essential.
The practical bit.
It just says you need supporting documents, follow the insurer's process. Sound like paperwork is key.
Oh, absolutely. Being organized, keeping receipts, doctor's notes, it's vital. Missing documents or not following the procedure can really slow things down or even lead to denial.
Right, need to cross your T's and dot your I's.
Pretty much. Understand what they need up front if you can.
Okay, and then point 9 gets into things that are likely not covered. Exclusions,
The what's out list.
like cosmetic treatments, STDs, complications from alcohol or drug use. These feel familiar, seem quite standard.
They are pretty common exclusions, yes.
Yeah.
Often related to things considered elective or potentially arising from lifestyle choices the insurer wants to limit liability for.
But the exact wording matters, I guess.
Always. What one policy defines as cosmetic, another might view slightly differently, especially if there's a reconstructive element after an accident, for example. Check the definitions.
Point 10 then touches on pregnancy, childbirth, abortion, saying there are conditions where these might not be covered.
Yeah, maternity coverage can vary hugely between plans.
So if that's relevant, you really need to dig into that section.
Absolutely critical. Look for waiting periods specifically for maternity benefits. Check limits on coverage for delivery, prenatal care, postnatal care. It's a big area to scrutinize if needed.
Makes sense. Okay, point 11. Geographical limits. Are you only covered in a certain area?
That's a common feature. Many policies specify a country or maybe a network of approved hospitals and clinics within a region.
And what if you need treatment somewhere else? Say traveling.
You need to check the policy's rules for out-of-area or out-of-network care. Sometimes it's covered, but maybe with a higher deductible or copayment. Sometimes it might only be for emergencies.
Right, or maybe you need to get approval first.
Exactly. Prior authorization might be required for non-emergency care outside the designated zone. Definitely something to check before traveling.
Point 12 is about second medical opinions. Is that something insurance usually covers?
Increasingly, yes. Many policies recognize the value of a second opinion for serious diagnoses or complex treatment plans.
Seems like a good patient right to have.
It really empowers you to make informed choices. The policy should explain if it's covered and what process you need to follow. Maybe you need a referral or perhaps use specific providers.
Good to know that might be an option. All right, let's dive into section 4, actually getting paid back. Claims. Point 13 again mentions required documents.
The paperwork trail.
Medical certificates, receipts, really hammering home the need for good records.
It can't be stressed enough. Keep everything. Originals if possible, or good copies. Dates, diagnoses, treatment descriptions, costs.
Okay. Point 14. How reimbursement works and any limits. Are there usually caps, like a maximum payout?
Yes, very common. Policies nearly always have limits. Could be an annual maximum for all claims combined, or per incident limits, or limits on specific types of treatment.
So you might still have out-of-pocket costs, even if something is covered.
Definitely. Understanding those limits, plus any deductibles or co-payments, is crucial for budgeting. And also check how they pay. Do they pay the hospital directly, or do you pay first and claim back?
Right, different models. Point 15, pre-authorization, needing approval before certain treatments.
Yes. This is common for major procedures, hospital stays, expensive tests like MRIs, sometimes certain prescription drugs.
Why do they do that? Just to control costs.
Primarily, yes. It allows the insurer to review the medical necessity before the cost is incurred. It ensures the treatment aligns with the policy's terms and helps manage overall spending. Annoying sometimes, but understandable from their perspective.
Okay, section 5, more specific exclusions. Point 16 lists a few interesting ones.
Let's see.
Congenital anomalies diagnosed within the first 15 days of life. That seems very specific.
It is. This kind of exclusion often exists because there might be other public health programs or specific newborn coverage mechanisms intended to handle issues detected immediately after birth.
Ah, okay. Also dental treatment, unless it's because of an accident.
Standard stuff. Routine dental hair fillings, checkups, cleaning that's usually under separate dental insurance. Health insurance typically only covers dental work needed because of an accidental injury to sound, natural teeth.
Makes sense. And the last one here. Expenses exceeding the policy limits. That's just reinforcing what you said about caps.
Exactly. The policy will only pay up to its stated maximums. Anything above that is unfortunately your responsibility.
Okay. Then point 17 on the third image. Policy cancellation or non-renewal. When can they actually do that?
Well, the most obvious reason is not paying your premiums,
Right.
but also potentially for fraud, like lying on your application or a significant misrepresentation of your health status.
Yeah.
The policy document will list the specific grounds.
Good to know those rules. Moving towards wrapping up, Section 6, renewals. Point 18, renewal process and factors affecting terms or premiums. You mentioned claims history earlier.
Yes, that can definitely play a role. Also, any significant changes in your health, maybe reaching certain age brackets, and even wider factors like overall healthcare cost inflation or the insurer's general performance.
So premiums aren't necessarily fixed forever.
Rarely. It's quite common for premiums to adjust at renewal time.
Okay. Point 19 mentions subrogation. That sounds technical.
It does, but the concept is fairly simple. It's the insurer's right to step into your shoes, basically, to recover costs from someone else who is responsible for your injury or illness.
Like in that car accident example, if the other driver was at fault.
Exactly. Your health insurance pays your medical bills quickly, so you get treated. Then, subrogation lets them try and get that money back from the faulty driver's liability insurance. It prevents you or them from recovering the same costs twice.
Got it. Point 20. Exclusions for riots, strikes, terrorism. Seems like big, unlikely events.
They're generally large-scale, catastrophic-type events. Insurers often exclude these because the potential scale of claims could be unmanageable under standard insurance models. Sometimes specific riders might be available, but basic policies often exclude them.
Okay. And the final point, 21, is maybe the most important.
Which is?
Read the whole policy document.
Absolutely. Couldn't agree more. This deep dive, it's a guide. It hits the highlights, the potential sticking points.
But it's not the full story.
Not at all. The full policy is the actual contract. All the specific definitions, terms, conditions, limits, they're all in there.
Yeah.
That's the definitive source.
Right. So let's quickly recap then. We've looked at the core coverage, accidents, illness, and those important waiting periods for pre-existing conditions.
And the coverage for major things like transplants and cancer care.
We touched on the specifics around HIV/AIDS, the exclusion there, but also the positive inclusion of mental health services.
Right. Then the conditions where you get care, home care flexibility, but also that routine checkups are often out unless specified as preventive.
And the claims process needing documents following rules, plus those common exclusions, cosmetic, STDs, alcohol drug issues.
And the variability of pregnancy coverage. Very important to check that.
We discussed geographical limits, the possibility of needing treatment elsewhere, and the value of getting a second opinion.
Yep. Then the claim details paperwork, reimbursement limits, needing pre-authorization sometimes.
And those very specific exclusions, like early congenital issues, routine dental, exceeding limits.
Policy cancellation reasons, how renewals and premiums work, subrogation.
And finally, those big exclusions like riots or terrorism. Whew, we covered a lot of ground.
We did. Hopefully it helps demystify this specific policy document somewhat, highlighting the key areas you really need to understand about your coverage.
So as you listening, think about all this. How does it map onto your own situation, your family's health needs?
Are there points we raised that make you think, I really need to double-check that bit in my own policy?
We hope this deep dive gives you a kind of framework, a better starting point for tackling that full document.
Use this discussion to guide your reading, to help you spot the crucial details and understand your protection better.
And maybe think about this. Now that you've got a handle on these key aspects from the document we reviewed, what other questions does it spark for you? What's your next step to feel confident your health care is properly covered?
Something to consider. Thanks for diving deep with us today.